Tuberculosis is an infectious disease of the lungs which is caused by bacterial agent known as MYCOBACTERIUM tuberculosis. Tuberculosis usually spreads from the infected person to healthy person via the droplets from cough or sneezing. Tuberculosis is also strongly associated with HIV, as HIV causes the immune system to be compromised and thus is easily been invaded with the TB bacteria. Phases of TB infection: latent phase. In this phase the bacteria is usually present in the body but the patient usually have not yet presented with any noticeable symptoms. It is this phase which when later on become active and leads to infection and symptoms of TB and can be contagious. Active phase: in this phase the bacteria is present and also have started infecting the person. It is this phase in which the TB patient notices symptoms. Sign and symptoms: the sign and symptoms of a TB patient in its active phase of its diseases usually have following signs and symptoms: fever, cough with sputum, fatigue, night sweats, noticeable weight loss, loss of appetite, chills. Tuberculosis and body parts involved: tuberculosis can infect the various body parts such as kidney, intestine and spine. Tuberculosis causes: tuberculosis is caused by the bacterium tuberculosis, an infectious bacteria whose course of transmission is via droplets usually from the sneezing and coughing of a patient having tuberculosis. Diagnosis: skin test. Tuberculosis can be diagnosed with skin test. Tuberculin is injected into the skin of a patient. The skin is observed after 48 HRS. If there is any presence of raised hard bump on the site of tuberculin injected, it likely confirms that the patient have TB. Imaging: chest X-ray plays also an important role in the diagnosis of the tuberculosis. A chest X-ray may show white patchy appearance, usually denser in the upper lobes of the lungs. Sputum test: tuberculosis can also be confirmed by a sample of sputum taken from the patient. Drug-resistant tuberculosis: as anti-tubercular usage is from the past 60 years, there are few bacteria which have shown resistance towards the anti-tubercular medications. Such patients usually do not respond to anti-tubercular and therefore treated with alternate medications in a very sensitive and observed manner. Treatment: anti-tubercular are the common medications prescribed once the patient history and diagnostic tests confirm the presence of bacteria in patient in its active phase. Following are the common anti-tubercular medications commonly prescribed: isoniazid, rifampin, pyrazinamide, ethambutol. Anti-tubercular and vitamin B6. Anti-tubercular impairs the absorption of vitamin B6 in the gastrointestinal tract, so the patients usually presents with the deficiency of vitamin B6, so patients with TB should be supplemented with vitamin B6 along with anti-tubercular medicines.